The State Department of Health announced this week that all New Mexicans over the age of 16 are eligible to receive the COVID-19 vaccine. That doesn't mean there's a shot at the ready, though. NMIF senior producer Matt Grubbs spoke this week to Health Secretary Dr. Tracy Collins.
Secretary Dr. Tracy Collins, thank you so much for making a few minutes to chat with us. I'm curious about phase 2, which is sort of the rest of New Mexico. If the White House hadn't recommended or asked states to get that, would you have recommended that New Mexico go there yet?
You know, it's a great question. Actually, we would have recommended it. It really is a matter of looking at making sure that we have sites that can provide vaccine, that they don't begin to slow down. So we would have opened it up. Yes, thank you.
Sure. As I understand phase 2, it's less than 100,000 people. We look at the 1.68 million people who are in the pool of people who can be vaccinated by DOH and the medical team. What's the purpose, I guess, of having a phase 2 if it's that small? I think a lot of people thought, wow, it's going to be a big chunk of New Mexico, but it really isn't.
Well, you know, given that New Mexico has a lot of residents with chronic conditions, the largest group are really those who are 16 and older with chronic conditions. And so when you think about phase 2, it's really making sure everyone can get access to the vaccine, even if they don't have a chronic condition. So yes, phase 2 is not very large, but we wanted to try and push as many folks who are at higher risk to vaccines first before opening up that phase.
Okay. Expanding to phase 2 with the reasoning that in some parts of the state, like Clovis or Roswell, where they can't fill all the available appointments, would another way to do that be to rethink how the state distributes vaccines? And instead of creating sort of the longer lines, and I say lines, but we know that's sort of theoretical, instead of creating those longer wait times for people, why not just rethink where this vaccine is going and sending it to the places that need it as opposed to the places that can't fill those appointments?
So, you know, there are multiple factors that go into how we distribute the vaccine and the rollout. We did definitely look at those who are at high risk throughout the state. Then we looked at areas with high social vulnerability. And then also looking at vaccine providers. So there are multiple factors, and we're trying to address all of those, keeping in mind the prioritization of those most at risk. So as we're looking at opening up phase 2, it really is to make sure that we have those sites that are somewhat slowing down on appointments, that they can keep their momentum going. So I appreciate your question, but there are multiple factors that played into how we rolled out the vaccine.
Okay. You've said 50% of New Mexicans, eligible New Mexicans, have received that first shot. The numbers that you shared this week indicated that, however, about less than half the state is in the registration system. So 829,000 people, I think, was the number that you shared this week in terms of the number of people who've gone online and registered to get that shot. That's less than half the state, less than half the eligible people, I should say. Can you help me understand how those two sets of numbers fit together?
So when you think about the registration app, it was rolled out about 2 weeks after we started receiving vaccines. And there were healthcare workers who were being vaccinated. And so there's a large proportion of those folks who didn't really use the app, at least for that first shot. And so we have that component. We have people who have actually been vaccinated who are not healthcare workers who also didn't use the app. So there is a subset of New Mexicans who have not used the app, but fortunately have gotten their vaccine. So not everyone is using the app. We do encourage that, but not everyone's using it.
Okay. If not everyone's using it, how are those people getting their vaccinations?
So they're getting them either through a site before, we actually encourage people to use the vaccine portal to register, but they could actually go to maybe a pharmacy or another site. And what will happen is that data will show up in a registration site. It's called NMSIS. It's required that we use that. So any vaccine we distribute in the state needs to be reported in NMSIS by a vaccine provider. So someone could, in fact, go and get their vaccine And then ultimately, we'll see that data in NMSIS, but it's not in our portal.
I see. So this is all, as you and I are talking, this is all sort of back end stuff, your interaction with the federal government, et cetera?
Right.
Okay, okay. The state has tried to maintain a high degree of control over who gets this. As you said, you've sort of tried to target those who need it most. Is there a point at which the state needs to sort of relinquish control? We've been at this for a couple of months at least. Maybe you would know better than I, but maybe 10 weeks or something like that with the portal. But fewer than half the state, half the people who are eligible are online, and I know that there is a group of New Mexicans who are getting vaccinated without that. But is there a point at which the state just needs to say, okay, have at it?
In general, actually, we are doing that now by opening up options for people to get, schedule their own appointments and not have to wait for an event code. I think for us, what we're trying to do is keep New Mexico safe. So we need to have some understanding of where people are with being vaccinated. So we can't completely back off. We really need to keep our eye on the data and making sure that folks who are most at risk are getting vaccinated, and then the entire state is getting vaccinated so that we can reach that point where we can stop the virus from replicating and also from mutating. So I don't think we can back off completely, if I'm understanding your question clearly. But I think what we're doing is trying to make it easier for people to get to vaccine appointments.
Okay. Is there, I guess if you're able to track who's getting vaccinated through this back-end system that we were just talking about, I think it was called NMSIS, is there necessarily a need for the front-end system that restricts who can get it and when?
So, at this point, we're not restricting it per se. We're actually trying to match the demand with what's available as a supply. So on the front end, we're trying to help vaccine providers by pushing people to appointments, helping them understand who wants an appointment. So that front end piece is still important.
Okay. Herd immunity, that's something that you've recently begun talking about. I know the scientific community hasn't reached a consensus. I'm hearing around 80%, maybe 5 less, 5 more. Given sort of the difficulty that the state has had in registering people into that system, and given sort of the polling that we've seen that say maybe a third of Americans have this concern or questions about the vaccine, do you think herd immunity is achievable in the state?
It's an excellent question. And please keep in mind, when you talk about herd immunity, that's where you're reaching a certain percentage of the population that you can help, either with the vaccine, with getting their immune system such that this virus cannot replicate anymore. We're still learning about this virus. We may not actually reach that herd immunity. It may become something where, like influenza, where each year we get a booster dose or a new vaccine just because there's such a change in the sequencing of a given vaccine or what we currently are treating. And so what I want to make clear, I'm sorry, I'm not being very clear right now, is that, first of all, we don't know if herd immunity is possible with COVID-19. It may be that it's not. If it were, we're looking at numbers around 70% or so, but also keep in mind, we've not opened up vaccine to children. So, because we don't have the data to say that it's okay to do this. We have some data from Pfizer on folks who are adolescents, so 12 to 15, that it's actually looking like it's going to be efficacious and safe to use in that group. But more trials are being done starting now with children who are younger and in the summer. So Pfizer is doing some work now, Moderna is going to start in the summer. And so, one of the challenges that you see nationally with this idea of herd immunity is that we don't know that we can reach herd immunity with COVID. But the more people we get vaccinated currently, the more likely we are to stop the replication, which is a good thing. So that's moving in the right direction.
Okay. New Mexico, at least as highlighted in the CDC numbers by Colleen Heald in the Albuquerque Journal, ranks well in terms of getting shots or needles in arms of the population overall, but there are some vulnerable communities that are being missed, and the state ranks much further down the list. 37th, I believe, was the number that the Journal reported. as opposed to the first in percentage of vaccines in arms. I know that's something that you're looking at. I know that's something that you're not insensitive to. Can you help me understand sort of how that came to be and what's being done?
Yeah, so the Social Vulnerability Index includes 15 factors: housing, who's living in the house, how vulnerable they are, other sort of determinants of health like income, education. All of those go into this measurement called Social Vulnerability Index. And that index, the higher the number, the more vulnerable you are. So, as a state, as you pointed out, we've done really well with getting shots in arms just in general. When we look at how we're doing with those socially vulnerable groups, that's where you're seeing a discrepancy. But please keep in mind that the data looking at that has not adjusted for how we as a state are really high on our social vulnerability compared to other states in the union. So when we consider that, and if you were to go back and look at that data and adjust for how vulnerable I'm going to say New Mexico is as a state, we're actually doing better. So that ranking, that 37th, is kind of a very crude and not well adjusted estimate of how New Mexico is doing. And if we begin to go back and look and say New Mexico compared to maybe Colorado, I'm just throwing that out as an example, we're actually probably doing a lot better than people realize, even with the social vulnerability. It's just that we're a sick state. I'm going to say that. There's a lot of poverty, a lot of people with chronic conditions. And so overall, we rank really high as a state compared to other states in the country for our vulnerability.
Dr. Tracy Collins, we appreciate your time. Thank you so much.
Thank you.